Today we're talking about electric stim. Electric stim is great to use with acupuncture. So I use it a lot. Roberto's a great example. So he is an old soccer player who has chronic knees, he has arthritis, he has a lot of tendon issues. So what we like to do is do regular acupuncture on it, which is the same, and then we add on the electric stim at the end. So what I'm going to do is I'm going to do 2 points, one called Qian, and then 1 point called gallbladder 34. They're like kind of my go-to points for any kind of knee pain. So we're going to put those in, and then after that, after those are already in, so this is one, so there's a medial Qian, you felt that, right? And then there's a lateral one, so there's 2 points. They're called the eyes of the knee, and I really like them for arthritis or any kind of tendon issues in the knee. And then we're going to put in gallbladder 34. After those 3 points are in, that's when we like to add the electric stim. So again, I like to use it with chronic conditions or any kind of long-term issues. Sometimes when you're an acupuncturist and you're not getting the greatest results or you're not getting any drastic change, that's when electric stim is a great addition. So they come with 2 little clasps, almost like you're putting to a battery. And what you're gonna do is you're gonna open up one clasp and put it on one of the points that you wanna do the stim on. And then you put the other one on the other side. And what it does is it brings a little more qi and blood to the area and stimulates this whole area. So the concept in Chinese medicine we think of is that there's stagnation in the body. And what we're trying to do is open up this stagnation. So we're trying to get movement. And the electric stim, what it does is it stimulates the qi and blood. So it brings more blood to this area to help it heal. And with the E-Stim machine, so it looks kind of like this. And what you're gonna do is you're gonna slowly turn it on. And you're going to wait till the patient says they feel it. You want to start really, really low. And then once you get a little bit of stim, Roberto, you tell me when you feel it. You should get it about now.
I feel it.
Okay. Then you would stop. And they sit with the needles and the stim for about 25 minutes. And again, it brings a little more blood and qi, and it's really great with injuries. It's one of my go-to things for any kind of chronic injuries. And you can actually see the needles, they stimulate a little bit, so they jump up and down, and that just means that there's a little more blood and qi kind of going to the area, and that needle's being stimulated. There's subcutaneous stuff where you can put it just on the skin layer, but the beauty of acupuncture and E-Stim is it goes a little deeper into the knee, and when it goes deeper, you can get a little more of a healing property. So there's more endorphins that are being released, and the body senses that this is where it needs to send its energy and what we call blood or qi to the area to help it heal.